The Western Highlands Provincial Health Authority is forced to use their operational budget to subsidize the central drug procurement process by paying area medical stores 6,000 kina a day to get their drugs and medical consumables.
While we get reasonable deals in the marketplace, of course, we're paying basically retail rates for drugs. You know, if you're buying them at wholesale prices, you're getting a much better deal. We've looked at importing drugs ourselves, but we can't get a license to do that. That's quite a difficult process.
They have been facing drug and medical consumable shortages since 2019. 2 weeks ago, they ran out of amoxicillin, a drug commonly used in the country. There were also no syringes, urine bags and others generally.
You go to a doctor here and you've stubbed your toe, then they're likely to prescribe paracetamol and amoxicillin. So they run out of everything, basically. You know, we have a lot of HIV patients admitted here. A lot of them are incontinent. They use basically adult nappies. They can't supply those.
WHPHA CEO David Vorst said the 76 million kina huge cut in the 2021 budget for provincial health authorities and the 54% cut for drug procurements will likely see more drugs and consumable shortages and closing down of health facilities.
The government has always said that education and health are a priority. But it's hard to see it as a priority if you cut 76 million kina out of the operational budget.
Vorst said the same model of procuring drug is still being used despite the Public Accounts Committee inquiry last year into the procurement process, which had exposed a lot of implications.
But that overall means that the 2021 outlook for health is not good at this point. And certainly, you know, if there were drug shortages before, there's certainly going to be drug shortages now.
The WHPHA budget cuts in the 2021 national budget has seen each PHAs getting 3.9 million kina. Hospitals such as Pomgen and Mount Hagen General Hospital are some of the busiest in the country, seeing at least 200 to 300 patients a day. At least 30% of Mount Hagen Hospital's adult patients are from the other Highlands provinces, as well as for the children. WHPHA board has written letters to provincial and local level governments of Western Highlands, Hela, Southern Highlands and Enga to help, but have received no positive response.
Enga and Tari and Southern Highlands, for example, are getting funded for the patients that I'm treating. And of course I've spoken to them about that, but we haven't been able to come to any agreement.
Vasinata Yama, National EMTV News, Mount Hagen.